Hello and welcome back to Long COVID MD. I'm your host, Dr. Zeest Khan. I'm a licensed and board certified physician and a patient with long COVID. I'm here to help you understand and recognize resources within our healthcare system that you can use to get better, even though our greater healthcare structure is not particularly designed for complex illness like ours. I have made significant recovery, and I hope the same for you. This episode is my January rundown. I started the rundown as a written piece of content for Substack. If you have not joined or subscribed to my Substack account, please take a look at it. It is longcovidmd.substack.com. There is supplemental information there that enhances this podcast. Today, I wanted to do the rundown as a podcast, a little bit more casual, and let you know what I've been up to in January and December. Traditionally, with the rundown, I give you a little bit of what has been on my mind, and then we dive in to one particular topic. So this week, it is cognitive rehab therapy through speech and language pathology, which is a resource that is available in most healthcare plans. I'll tell you about my experience with cognitive rehab through SLP. But before we do that, let's do a little bit of housekeeping. If you messaged me in December and I have not responded yet, please allow me a little bit of grace. I have realized I have missed some listener emails, and there have been some that I just have not responded to. December was a little bit busy for me, as has January, and I'll tell you what I've been busy with. And I do my best to respond as soon as I get the email, but I fall into that trap of sometimes reading an email and making the plan to respond later, and then realizing that later never came. So it is on my to-do list now. So I've had two big projects. What I worked on in December was my webinar that I presented earlier this month. I'm going to leave a link to that. It's now available on YouTube. I was invited to give the first Project Echo talk of 2025, sponsored by the University of Utah and Bateman Horne Center. My topic was speaking to medical professionals and helping them understand ways that they can treat patients with complex illness and poorly understood disease like long COVID, using the resources that are at their disposal, even though we don't have really clearly established guidelines for care. I talked more about that in the last podcast episode here, and I'll link more about that in the show notes. This month, I was very honored to spend some time writing an article for a very well-established journal. I know that many of you feel discouraged about doctors, about our medical system, but I want to let you know that there are people who are very influential who want to learn more about long COVID and want long COVID to be a topic of discussion and improve medical education about it. Some of these people are in my network, and I was very honored to be invited to submit a paper to a medical journal about my experience with long COVID and my recommendations for taking care of patients with long COVID. I'll keep you posted on what happens with that, but I am very, very proud of myself for writing it, and I'm very, very touched by the network of physicians that I am in who are advocating for me and are advocating for you. I know that change is very slow coming, and we may not have access to what's going on behind closed doors, but there is an interest in long COVID. It is not being dismissed. It is being taken seriously, and I remain very hopeful. It was really hard to create these presentations and do this work. I have shared before on this podcast that I do struggle with cognitive impairments after my infection. I am doing tremendously better now than I was in 2021 when I had to stay in a dark room and could not tolerate sunlight, could not tolerate sounds of my kids playing, and I could not communicate clearly. Things are a lot better, and I am happy to report that I am doing things every day that I wished and hoped I could do when I was trapped in that dark room. I want you to remain hopeful too. They were desperate times. And so, even though I am not back to my very high functioning baseline, I'm so grateful for the life I currently have and the abilities that I'm able to access that really were not accessible to me and were really ripped away from me after 2020. So today I wanted to talk about how I was able to do these projects, like my workflow. If it's hard for me to think straight, how could I record a webinar? How could I write a paper for a scientific journal? And there's the answer, has many branches, but one of the things I want to focus on today is my experience with cognitive rehab through speech and language pathology. I did not know that speech and language pathologists specialize in rehabilitation after neurologic injuries like traumatic brain injury and stroke. And so once I discovered that that was a resource, I advocated really strongly to get into a program. So I have been working for the last many weeks with a speech and language pathologist who specializes in cognitive rehab. Together, she has helped me identify the cognitive impairments that I have. She has helped me make sense of the symptoms that I have had a very hard time describing. She has taught me about the different types of memory and different aspects of executive function and has worked with me to help reduce the effort that it takes me to perform a cognitive task. She's helped me improve my workflow and approach to, I guess I'll say, computer work and reading, even reading comprehension. I'm working on that along with my school-aged kids. And now we are working on specific exercises to help improve and bolster my cognitive performance. It is such a valuable resource. These have been such helpful exercises. And if you have not yet had the experience of working with someone who asks just the right questions to help develop a very specific plan of action, I am hoping that you get that experience soon. It really moves the ball. There's a couple of aspects of cognitive therapy that I wanted to explain today. Actually, two aspects of executive functioning that I wanted to explain. And then I wanted to share a couple of specific tips of ways I have modified my workflow that really help me. So, executive functioning, the two aspects of executive functioning I want to talk about today are working memory and attention shifting. Working memory is a type of short-term memory. It is also part of the executive functioning skill set that humans have. I think about working memory as the backpack that a student wears, the purse that I would carry to run errands, the tool belt that someone in construction walks around with. It carries the tools that are needed to get a specific task done. The person carrying that bag knows what tools are inside and knows how to retrieve them, then knows how to use them. What has happened with me, as it has with, it seems like many people with long COVID, is that our working memory has a new impairment or deficit. I don't know what is in my backpack anymore. I sometimes don't know where my backpack is. At worst, I didn't know what a backpack was. What I have been doing with my speech therapist is better understanding my working memory bag or basket and learning ways to access and retrieve what is in that basket or what should be in that basket, learning ways to replenish it, and as importantly, learning how to do a task without having to access it as frequently. Because each one of those steps requires cognitive exertion, requires effort, and will take from your energy envelope. But it's been very cool to learn about and may explain why I lose track of my thoughts mid-sentence, why I cannot remember or retrieve names, words, numbers, and so on. The other aspect is attention shifting, and that is what it sounds like. It is our ability to seamlessly switch between tasks and reorient ourselves as we switch between those tasks. I shifted my attention seamlessly. As an anesthesiologist, I had to do it over and over and over and over again while keeping focus on the tasks at hand. I am having a much harder time switching between tasks and remembering what I need to do. I get very tired if I switch between tasks too frequently. I am more likely to get confused. I am more likely to lose my train of thought, and I am more likely to get fatigued. What is great about working with a medical professional is that when I described these symptoms, I did not have clear words for them, and I had a lot of difficulty describing them. I felt kind of silly trying to describe them, but because my speech pathologist has training and knowledge about this, she was able to identify what the symptoms meant and able to educate me further on ways to improve them. And so I think as I'm reading more about this, I see similarities between traumatic brain injury. I see similarities between autism and attention deficit disorder. Those similarities are not completely clarified yet, but whatever resources are currently available and seem to benefit people with similar symptoms, those are ones that are worth tapping into. I will tell you, I have really enjoyed working with cognitive rehab in this way, a really personalized approach, working with another human being. We do all of our visits on telehealth. And it has been very practically beneficial for me too. I'm starting to read journal articles a little more smoothly. I'm practicing retaining information using the methods that she has suggested. And a lot of it is simple. A lot of it is ultimately pretty basic. But it's also very appropriate for me and helpful. Let me share a couple of things that have helped. One is that she has recommended me move away from electronic devices to keep track of reminder lists or timers. I am not a hyper organized person, but I do love a list. And so I make lists in several apps on my phone, but then I forget that they're there, and I forget where I kept each list or each task. And the other problem was when I picked up the phone, there was just such a chance of being distracted by something else on the phone. To reduce all of those distractions, I am now using a small notebook that I keep at my desk and that I take with me if I am running errands outside. Because boy, I will tell myself I need 3 things and then I get 5 things and forget 2 of the original items. So I have a paper list, again, simple but really effective. And for a timer, I bought a little adorable multi-faced cube timer that has numbers on each face that correspond with a preset time. And I set that as my boundary of working. Setting a strict time limit on cognitive work, like writing, recording the podcast, doing research, has been very important, and it has also been very challenging. It is important because if I identify how much time I can typically work without crashing afterwards, I'm going to be better off. My speech therapist has helped me determine what an appropriate time limit is for me. And it certainly fluctuates based on my health on that day or at any given moment. But it has been nice to try to stick to a specific time limit to complete a very clear and focused task. Both of those are exercises that require practice. She has also helped me identify the signals that my body is sending me to let me know when I am overdoing it and harming myself. Cognitive impairment causes symptoms like headache, eye strain, nausea in people who have traumatic brain injury. And those are signals that we should not ignore if they develop while we're trying to exert ourselves cognitively. It is really challenging, however, to implement this and to, when the timer goes off, stand up and say, okay, my work period is over. It is challenging to do that because I am used to working really hard and pushing through, probably like you. It is also challenging because it is a perpetual reminder that I have limitations. And that is something that is, it's a really tough pill to swallow. It is a challenging reality to face. And boy, at the beginning, like I was starting with a very limited amount of time. But the time is growing, and I anticipate it's going to continue to grow, but it's not going to grow effectively if I sabotage myself and try to overdo it. I get post-exertional malaise after I overexert myself physically. I also get post-exertional malaise if I overexert myself cognitively. That presents very similarly to the physical malaise or the like post-physical PEM, but I have an additional symptom of having like buzzing through my body or sort of hyper wired. And it's really difficult to discharge that. So while I have methods in place that help me recover after physical exertion, I recognize now that I have to continue working on finding ways to effectively recover after cognitive exertion. And those two methods might have some similarities and they might be different. I am still learning how to best recover after a cognitive task. It's challenging. It's a lot of work, and it requires a lot of insight. So if you have access, like I said, to speech and language pathology, cognitive rehab, if you're having cognitive impairment, I highly recommend it. So I'll leave that discussion there about cognitive impairments and utilizing speech and language pathology. Let's pivot a little bit to the news, the events of the world. It has been really emotional listening to the news, reading through headlines, and in particular, reading through social media. Bad things are happening all over the world. The new executive administration in the US has been very action oriented, I'll say, at the beginning of the term. And it's thrown a lot of people off, and it has made a lot of people nervous, myself included. I don't really want to talk too much about specific policies. And I am hoping that the US, when all of this shakes out, recommits itself to exquisite scientific research and to finding the biological underpinnings of long COVID. I also hope that we continue to fund global health initiatives and support ill people all around the world, including those who've been affected by the HIV virus. So I'm going to stay optimistic. All that being said, I want to talk about the ways that we consume this news and consume and interact with social media. I do not have a particularly addictive personality, but that word addiction has been bouncing in my head when it comes to social media because I have been stuck in my phone for these last weeks, and I have gotten hooked in after not being hooked in for quite some time. I don't like how I feel after doom scrolling. I have symptoms that are very similar to the post-exertional malaise symptoms I have after working really hard. But nothing really productive has come out of it. And worse, I am emotionally drained too. So most of the time, my consumption or overconsumption is not helpful, and it is causing harm. So I talked in earlier episodes about being very intentional with our use of social media and recognizing when we have read enough headlines and are caught up with the news. The thing with social media and disability is that I'm probably never going to walk away from Twitter. It has been a lifeline. It has been a way that I have connected with you, with other people who are ill, with advocates in the space, with scientists in the space. And because we are isolated and we have limited opportunities to network with one another, social media is going to remain in our lives. So I am reminding myself to recognize when I need to walk away and maybe, create a workflow around social media consumption. Well, that's it. That's it for this episode. That was the December/January rundown. Let me know how you are doing. How have the last few months been? It has been pretty eventful between the holidays and the inauguration. How are you protecting your mental health? How are you consuming the news? And let me know if you are battling cognitive deficits right now, how you are navigating those. Have you worked with a speech and language pathologist in cognitive rehab? Have you utilized a computer-based program to try to meet these needs or make these improvements? I know that some of those exist as well. What works for you in your work? What are you continuing to struggle with? I know some of you are still able to work. I'm sure you have had to make accommodations. And for some of you, it's very challenging to re-enter the same type of work that you were doing before. I would love to hear your story. You can email me at longcovidmd gmail.com. If you are listening on Spotify or Apple RSS feed, there is a little link in the show notes that says text us. You can send me a message there. If you're listening on Substack, you can leave a comment or a voice note. No matter where you're listening, you can leave a voice note. I will leave the link for that in the show notes as well. I hope you're feeling well, and I'm looking forward to talking to you again. Until next time, bye for now.